Health Watch, as always, we're joined by Dr. Syed Hussain from Trinity Health of New England. Good to see you again, Doctor.
Likewise, Tim.
Glad to have you here. And today we're talking about something I know nothing about, but it's a growing trend. Mushroom coffee. There's a lot of hype around this. I won't call it a coffee alternative because it's generally, I think, mixed with coffee beans, but has less caffeine than regular coffee and supposed to have health benefits. But how does this all work?
Yeah, mushroom coffee beverages, Tim, are having their moment in the spotlight right now. So basically, these are not mushrooms that you get at the grocery store. These are medicinal mushrooms, which undergo a pretty extensive process of drying, of extraction, of grounding, and in a 50-50 ratio, they're added to coffee beans. And that's basically what you come up with in terms of mushroom coffee, and it is quite the rage right now. But and it's the premise here is that because of the antioxidant properties that mushrooms contain, it may be beneficial in terms of boosting the immune system, relieving stress, anxiety, and even folks go as far as saying it may have some cancer preventing properties and others, but there's not a lot of research on that.
Yeah, well, okay, so the first thing I heard, if it's being ground 50-50 with coffee, that would make sense that I guess it has less caffeine in it.
That's right.
That seems fairly simple. And always that word, it may do a lot of these things. I'm guessing that's because mushrooms themselves have been shown to possibly have these properties, but as always, sometimes the preparation matters. Just because maybe the mushrooms themselves might have this quality, does that mean if you grind it up and put water in it, you're still getting the same benefits?
So it's basically, these are medicinal mushrooms. And remember, mushrooms have been used, they've been cited in scientific studies for thousands of years. Chinese medicine, Ayurvedic medicine, they attest to the properties that mushrooms may confer, beneficial properties that they may confer to the immune system and other systems of the body. But the research is a little flimsy, it's a little thin in terms of, does this actually work?
Right. Do we have any idea that there's any harms from trying mushroom coffee?
Not really. And if folks are wondering, how does this taste like? I haven't tasted it, but apparently it tastes nutty or earthy in terms of the taste.
Yeah, it sounds like it. Okay, so it sounds like it might be worth a try. I mean, at least it's no harm, but it looks like the jury's out as to how much benefits you're actually going to get. Okay, coming up, it's Men's Health Month. According to the Centers for Disease Control, in the U.S., men's life expectancy did finally start going back up again after a drop because of the pandemic and opioid problems. But there's always been a gap between how long men live and how long women live, which is a lot longer. And it looks like that gap is growing. Maybe men on average living to 75, whereas women living past
over 80. Yeah, that's right. There's a 5-year age gap. So historically, like you said, Tim, there's always been an age gap, primarily driven by two important things. And I'll get to a couple others, but the first one is heart disease. Men tend to get impacted earlier on in their lives with heart disease and will likely die from that more than women. And lung cancer, linked to the last 100 years or so, smoking. Majority of smokers were men, and that is linked to lung cancer. But then also men are a little bit more hesitant in terms of getting those appointments and setting up, seeing a doctor, going to the dentist, taking care of themselves than women. So all of that adds up. And then the pandemic didn't help. The pandemic actually worsened that gap, and men were impacted more, probably because they have more underlying conditions, et cetera, because of the things that I just mentioned, and were impacted by the virus.
Yeah, I imagine these are all not discrete factors. Obviously, you mentioned lung cancer. That's coming from smoking. Heart disease, is that something inherent to men, or is that just because men, A, try not to take better care of themselves, and women, B, don't go to the doctor as much?
Men can do better in terms of taking care of themselves. There's, all the risk factors that lead to heart disease can be controlled, can be managed appropriately, Tim.
Yeah, okay, so what are some of those basic tips that we should be
So take-home points: have an active lifestyle, have a healthy diet, and then most importantly, especially when you touch the age of 40 or so, make sure you have a regular annual wellness visit with your provider. Set it up, get the age-appropriate cancer screening, whether that's lung cancer screening if you're a smoker, or colon cancer screening. All of those are important, and again, it goes back to making sure you have a provider.
One last thing I'm curious to get your input on. I'm smiling. I know you are too, because we've talked about these things before, and I've also heard it said that men generally tend to undertake riskier behaviors.
That's true.
In other words, doing stupider things that are likely to get you killed at an early age.
That's true. Great point, because some of the other contributing factors to men having a lower life expectancy is accidents, it's overdoses, it's alcohol, it's all these other things which, go to your point.
And I don't want to preach without making this about myself. I just did something stupid recently and got myself hurt that I shouldn't have done. Something that my wife would not have done. There you go. I could have killed myself early on.
Have to be careful, Tim.
Yes, please do. Most importantly, guys, go see your doctor. That is a main reason. I mean, you should be having 5 extra years to your life living as long as women, and that just isn't happening. But,
that's right.
Doctor, thank you for the time.
Thank you.
We always appreciate Dr. Syed Hussain. Erica, over to you.